Even when they're given properly, over 15% of standard mandibular blocks fail, often because of a variation in the normal anatomy. In 1973, Dr. George Gow-Gates, a general practitioner of dentistry in Australia, described a new approach to mandibular anesthesia. His technique, which he'd been using in his practice for about 30 years, is a true mandibular nerve block. It is indicated when we are carrying out procedures on either one or multiple mandibular teeth in one quadrant, as well as for procedures on the lingual soft tissue or the buccal soft tissue anterior to the first molar. For surgery on the molars, a separate buccal nerve block may be required. It is particularly indicated if there is a history of failure of the standard mandibular block and evidence of accessory innervation. The nerves anesthetized with the Gow-Gates technique include the inferior alveolar, mylohyoid, lingual, and auriculotemporal nerves. The same tissues are anesthetized as with the standard block, except that about 75% of the time the buccal nerve is also anesthetized, eliminating the need for a separate buccal injection. The objective of the Gow-Gates technique is to deposit local anesthetic immediately anterior to the neck of the condyle. This is in close proximity to the mandibular branch of the trigeminal nerve after its exit from foramen ovale. With the Gow-Gates technique, we should be able to anesthetize all of the sensory branches of this nerve, including any accessory nerves.